The quizmaster will read the question, and she will repeat the question a second time. Once the quizmaster finishes reading the question for the second time, you'll have an additional 30 seconds to answer the question. So the timer will begin after the quizmaster has read the question for the second time, and the timer is set for 30 seconds. Once you provide the answer, the quizmaster says either the answer is correct or the answer is not correct. You are awarded 1 point for a correct response, no point for an incorrect response. There is no partial credit for a partly correct answer. You have to satisfy the quizmaster. If you dispute your score, the quizmaster will confer with the judges and the decision will be final. The fourth oral round question can be answered by any one member of a team. The team selects the person to answer question 4, as mentioned earlier. If there is a tie, one member from each of the tie teams will participate in answering a tiebreaker question drawn randomly from the remaining question pool. The team selects the person who will compete to answer this tiebreaker. Now, for the tiebreaker, you will select the person and that individual will step forward. The quizmaster will read the question and the first person to answer the question correctly out of the 2 teams that have tied would earn the mark. An incorrect answer takes 1 point away from the team score. You understand that? You've had a tie, you both stand up, and the question is given to you. The first person to answer the question correctly gets 1 mark, and that's it. If that person gets it wrong, it's -1, and also that is it. All right? The other team wins. If more than 1 tiebreaker round is needed, a new team member must step forward to answer for each round. Are we clear? Back to you, Sue.
Okay, and just a message for the judges. So the students are all going to pick a number from 1 to 20 out of this little box, out of this little bowl. And so the question numbers on your sheet are numbered 1 through 20. And those numbers, then you look for those so you're ready to determine whether or not the answers are correct or incorrect to help me. So to begin, all A1, B1, C1. Oh, you're doing B1, B, okay, that's fine, okay, that way. One person from each team come forward, and you're going to draw. Well, actually, should we do it just one at a time? Okay. One at a time, we're going to draw a piece of paper out of here. So, Team A, come forward. Yeah. Okay, but then it's 1 ABC, 1 A. See. Okay, so see, I thought it was A1, B1, and okay. So A's can pick one as a team. Pardon? Oh, this is something somebody wrote. It's okay. I mean, this has nothing to do. Oh, I think we have another one, don't we? Maybe not. Okay, maybe not. Maybe not. Yeah, you're right. We're just getting his. Okay, you can share the correct answers with one of them. Okay. So then you want the A from over there to come first, correct? Okay, you step forward. What is the number on your, pardon? Number 10. We need a second mic. Good. And this is one that is funny because it's in the back. Number 10 is actually down here. Number 10, no. Number 10 is down here. I had to renumber them down there for a reason. There's a reason for that. Okay. Oh, yeah, 10. Okay, so 10 is actually on the back. I'm just, because remember, this is one that had to be changed. Okay, so I'm going to read the question. I'll read it again. If you don't understand some words that I say, please let me know. So this one's pretty simple. Describe 3 immune functions of the liver. If you have the answer, you can answer it right away. Otherwise, I can repeat the question.
Number 1, the liver produces the coagulation factors. Number 2, the liver produces the complement proteins. Number 3, the liver produces the immunoglobulins.
Okay, I'm having trouble understanding the words that he's using, so maybe you should be a scorekeeper instead.
Number 1, the liver produces the complement proteins. Number 2, the liver produces the coagulation factors. Number 3, the liver produces the immunoglobulins.
I heard that part. I heard immunoglobulins.
Coagulation.
Yeah, coagulation factors. But that's not the immune function. This is the immune function. So, incorrect. Incorrect. This was the immune function, not the function of the liver, the immune function.
Immune functions.
Okay, I need a...
Next.
Yep. And,
Question 4.
okay. Question 4. Describe the pathway by which vitamin D deficiency can cause secondary hyperparathyroidism.
Could you repeat the question?
Sure. Describe the pathway by which vitamin D deficiency can cause secondary hyperparathyroidism.
All right, so vitamin D is involved in the absorption of calcium by increasing the absorption in the intestines and the kidneys, reabsorption in the kidneys, absorption in the intestines, and so by increasing calbindin and TRPV5 and VS6, it increases calcium. So when there's reduced vitamin D, reduced absorption of calcium, which will be detected by the calcium sensing receptors inside of the calcium sensing receptors, and when it's low, then it's going to be increased release of parathyroid hormone, which is in an attempt to increase the calcium ions.
Did you say it right? What question was it? Number 4. Yeah, I thought so. Okay, correct. I thought he said decreased parathyroid, but he said increased. Okay, that's what I wasn't sure. I misunderstood a word you said, and that's why I questioned it. I thought you said the opposite direction. So, okay, number 15.
15.
Okay. Describe respiratory sinus arrhythmia, RSA, and explain how it increases the efficiency of the cardiopulmonary system.
Can you come again, please?
Describe respiratory sinus arrhythmia, RSA, and explain how it increases the efficiency of the cardiopulmonary system.
Respiratory sinus arrhythmia just comes when there is this kind of respiration where during inspiration the venous return will increase, and that increase in venous return is going to cause too much ventricular and atrial systole, and that's going to affect the cardiac output also to the muscles, and that's how it's going to affect the cardiopulmonary system.
Help me, team. Right. Incorrect. Incorrect. Shall I read the correct answer? Do you want me to read the correct answer for these or not? Okay, so RSA is a pattern of higher heart rate during inspiration and slower heart rate during expiration. Increasing heart rate during inspiration increases blood flow through lung capillaries when alveolar oxygen is higher, which allows more blood to become oxygenated. Decreasing heart rate during expiration decreases blood flow through the lungs, through the lung capillaries, when alveolar oxygen is lower, ventilation perfusion matching, and also saves cardiac energy. Okay. It's going to take a long time. Okay. Okay, we're not going to do it. What's the next question?
16.
Okay, next in line. Describe the mechanism that creates airflow into the lungs.
So the mechanism that creates airflow in the lungs, we begin with the diaphragm contracts. That one causes the diaphragm to lengthen, increasing the volume within the thorax, hence reducing pressure, which allows air to move from the atmosphere into the lungs, and there is a decrease in alveolar pressure with a more decrease in the pleural pressure, thereby a decrease in transpulmonary pressure, which allows the air to reach into the lungs.
You're okay. Correct.
Next. 11.
Okay. Explain the role of ATP in skeletal muscle contraction and skeletal muscle relaxation.
Help me repeat it.
Explain the role of ATP in skeletal muscle contraction and skeletal muscle relaxation.
Okay. So in skeletal muscle contraction, ATP is going to be important to provide energy so that we can have binding of calcium to the tropomyosin C. And then also in relaxation, you find that when you have less of ATP, you won't have the detachment of the myosin from the actin heads. So we need ATP so that we can have the energy, so that we can break the bond between myosin and the actin heads, so that we can have the adequate relaxation of the skeletal muscle.
Judges? Judges? Advice? You're shaking your head yes. Okay. Correct.
Next.
We've already done 5. We're 1/3 of the way through the first part here, a quarter of the way through this round. The reason we're doing this number picking rather than just going in order is just in case somebody thought, oh, you knew that team such and such was going to need these questions and stuff like that, which of course wouldn't have happened. So we really didn't need to do this number picking, but we decided to do it. All right. So whatever is B, whatever.
B, please step forward.
your number.
13.
Number 13, judges. Explain how hypertension, chronic high blood pressure, increases end systolic volume, ESV.
Chronic hypertension increases end systolic volume by increasing the afterload, such that when the afterload is high, there's less blood that you can eject out of the heart. So at the end of the systolic contraction, you have more blood left in the heart because of the increased afterload.
He's got the increased afterload, so yes, correct.
Nine.
9? Okay, staying on the same page. Explain how habituation affects a response to a stimulus. You want me to repeat it? Okay. Explain how habituation affects a response to a stimulus. No idea? Okay. Okay.
Next. 2.
Okay, this is going to be a longer question, so I may need to repeat it. But it doesn't mean that the answer has to be longer. So, clinically, we monitor homeostasis of various substances by taking a blood sample and analyzing the plasma. Would knowing the plasma concentration of sodium also tell you its concentration in extracellular fluid and intracellular fluid? So the two of them separately, meaning defend your answer. Would you like me to repeat it?
Yes.
Okay. Clinically, we monitor homeostasis of various substances by taking a blood sample and analyzing the plasma. Would knowing the plasma concentration of sodium also tell you its concentration in extracellular fluid and in intracellular fluid, and defend your answer?
Okay, thank you. So knowing the concentration of sodium in a plasma, it is going to help us to know the concentration of sodium in extracellular fluid. Because plasma, when we say extracellular fluid, it has two components, where it has plasma and interstitial fluid. But I don't think knowing the concentration of sodium in a plasma cannot help us to know the concentration of sodium in intracellular fluid. Thank you.
Correct.
Can we kindly refrain from making comments? Let the judges decide. Okay? We may not speak Swahili, but we do know what sawa means. Kindly keep your comments. Asante. Next, please. $14.
Okay. How does the duration of an action potential in contractile myocardium differ from the duration in skeletal muscle, and how is this difference physiologically significant?
Could you please repeat the question?
Will do. How does the duration of an action potential in contractile myocardium different from the duration in skeletal muscle? And how is this difference physiologically significant?
So the duration in the contractile myocardium is going to be longer than the one in the skeletal muscle. And this is very significant because the contractile myocardium has a longer plateau, and there is going to be a longer absolute refractory period, unlike in the skeletal muscle.
Correct. Why would a drug that enhances the effects of GABA be used as a treatment to prevent seizures?
I beg your pardon? Could you
Repeat
repeat
it?
that question?
Why would a drug that enhances the effects of GABA be used as a treatment to prevent seizures?
Okay, so GABA is an inhibitory neurotransmitter. So if we use and seizures are usually as a result of overexcitation or overstimulation of neurons. So if we use an inhibitory neurotransmitter, that's going to reduce the firing in the neurons and reduce the amount of seizures.
Correct. Okay, we are now officially 1/2 of the way through the oral round, unless we need a tiebreaker.
Twenty.
Okay. A patient admitted to the hospital with acute ketoacidosis and dehydration was given insulin and fluids containing potassium and other ions. Acidosis is usually accompanied by hyperkalemia. So why was potassium included in the fluids for rehydration? Would you like me to repeat it?
Yes.
A patient admitted to the hospital with acute ketoacidosis and dehydration was given insulin and fluids containing potassium and other ions. Acidosis is usually accompanied by hyperkalemia. So why was potassium included in the fluids for rehydration?
Potassium was included in the fluid to reduce the hydrogen ions, because we normally have the potassium hydrogen ATPase, and also to help push glucose back into the cells.
Wrong.
Seven.
An unmyelinated axon has a much greater ATP requirement than a myelinated axon of the same length and diameter. Why? Would you like me to repeat it?
Yes.
An unmyelinated axon has a much greater ATP requirement than a myelinated neuron axon of the same length and diameter. Why?
An unmyelinated axon, for it to transmit the action potential, requires to have the action potential throughout the axon. Hence, it will require more energy for that action potential. But myelinated axon only has action potentials at the nodes of run via. Hence, there'll be less energy used and faster transmission.
Correct.
Next. Twelve.
What was it?
12.
Okay, 12. How does the role, somebody saying something? Quiet. How does the role of dihydropyridine receptors, DHPR, in excitation, contraction, coupling differ in skeletal muscle and cardiac muscle?
Could you repeat again?
Sure. How does the role of dihydropyridine receptors, DHPR, in excitation, contraction, coupling differ in skeletal muscle and cardiac muscle?
Okay, in the case of the secretor muscles, the electrical coupling is going to increase, but in the case of the, is it the smooth muscle, the second? In the case of the cardiomyocyte is going to decrease. The electrical coupling in the secretor muscles is going to increase, but in the case of the cardiomyocyte is going to decrease.
Wrong.
Next. '18.
Blood doping is the name given to processes that increase blood oxygen transport in athletes. Name 2 ways blood doping is achieved. I can repeat that. Blood doping is the name given to processes that increase blood oxygen transport in athletes. Name 2 ways blood doping is achieved.
One is by use of exogenous erythropoietin hormone. Second, transfusion of red blood cells.
You only need to give 2, and those are 2 of them, correct. There were a few others he was ready to give us, but he only
Next.
needed to give us 2.
Next. Six.
Gonadotropin releasing hormone, GnRH, antagonists decrease sperm production. Why are they not used widely as male contraceptives? Would you like me to repeat it? Okay. Gonadotropin releasing hormone, GnRH, antagonists decrease sperm production. Why are they not used as male contraception?
I'm not getting the accent well.
Should I do it again? You want to read it? Which one?
I'm not getting the accent well.
Gonadotropin releasing hormone antagonists decrease sperm production. Why are they not widely used as male contraceptives?
Yes. So, gonadotropin releasing hormone antagonists would prevent the release of gonadotropin from the hypothalamus. Gonadotropin releasing hormone from the hypothalamus, which will also decrease the release of follicle stimulating hormone and luteinizing hormone from the anterior pituitary, and those hormones are required for spermatogenesis, and they will also cause impotence in male, and they will cause testicular atrophy, and yes.
You think, okay. What do you think? You read this answer. I think he had the essence. It decreases, well, he said that kind of, yep. I think it, okay. Oh. So, okay, the overall thing is no. It wasn't quite right, but I was thinking that maybe some of it was there, but you missed a key point to it. So incorrect.
You were going towards it, but you didn't mention everything.
Okay, so, no, right. So that was incorrect. So now the round is each team will pick one number and send one person from the team forward. Okay, so team 1 can send someone forward.
$17.
Alveolar air has an average PO2 of 100 millimeters of mercury, but expired air has an average PO2 of 120 millimeters of mercury. If oxygen is moving into the body of the alveoli, why is there a higher oxygen concentration in the expired air than in the alveoli? Would you like me to repeat it? Alveolar air has an average PO2 of 100 millimeter of mercury, but expired air has an average PO2 of 120 millimeters of mercury. If oxygen is moving into the body at the alveoli, why is there a higher oxygen concentration in expired air than in the alveoli?
Idea we'll be having a higher PO2 in expired air than in the alveolar air, because the alveolar air, we're having a lot of anatomical dead space inside the bronchial airways. So the expired air from the alveolar will mix with the anatomical dead space, which doesn't involve itself in gaseous exchange, which makes the PO2 in the expired air to be higher than the PO2 in the alveolar level in the expired air.
Correct.
Next. $19.
19. Okay, same page. Plasma proteins and glucose do not typically appear in the urine of healthy individuals. Why not?
This is because even though they are ultrafiltrated within the proximal convoluted tubule due to secondary active transport, they are reabsorbed 100% co-transported with sodium.
Are we okay? No, what are they missing? Okay. Okay, they didn't say this. Yeah, so see what you, yeah. So yeah, okay. Incorrect. Oh, I see. So the glucose, but not the, he explained the glucose problem, but not the plasma. Yep. Yeah, he only described one of the two. Yeah.
3.
A patient with body osmolarity of 300 milliosmoles is given an IV composed of 300 milliosmol sodium chloride and 100 milliosmolar of urea. At equilibrium, what has happened to the patient's intracellular osmolarity and intracellular volume? Repeat.
Yes.
A patient with body osmolarity of 300 milliosmolar is given an IV composed of 300 milliosmolar sodium chloride and 100 milliosmolar urea. At equilibrium, what has happened to the patient's intracellular osmolarity and intracellular volume?
Okay, thank you. So the infusion of isotonic solution like that of 300 milliosmol of milliosmol solution of glucose is going to make intracellular volume to decrease, because water is going to move from intracellular to extracellular fluid, which is going to increase extracellular fluid. But okay, let me repeat my answers. It's going to make that volume of extracellular fluid increase, but there is no change in either intracellular or extracellular fluid. But extracellular fluid volume is going to increase, and then urea, as it doesn't have any effect on osmolarity of solution. So final answer, I can say that the intracellular fluid volume and osmolarity, there is no change is going to happen. Thank you.
Okay, I think he missed. I'm pretty sure if I was following the answer, it was incorrect, because in the end, say your final point again. So my answer is.
I say that the extracellular fluid volume is going to increase, but intracellular fluid volume, there is no change. And osmolarity of intracellular fluid is good, there is no change.
Incorrect.
Next, please. Please remember there's a 30-second timer after the second time the question has been read. 1.
Explain the difference between negative feedback and positive feedback.
Could you please state the question again?
Explain the difference between negative feedback and positive feedback.
So, in negative feedback, when you have like an effect, a response, it is going to decrease what is causing it. For example, if a hormone is produced and it has a certain effect, when the effect takes place, the effect or the action produced can reduce the hormone that is being produced. While in positive feedback, for example, in breastfeeding, the effect, what is produced, continues being produced, causes a continuous loop to increase the production.
I think it's correct. Yeah, correct. They weren't, I guess.
5.
Damage to the median eminence causes disruption of the hypothalamic hypophyseal portal circulation. In this case, what would happen to the plasma levels of ACTH, insulin-like growth factor 1, and oxytocin? I'll repeat that. Damage to the median eminence causes disruption of the hypothalamic hypophyseal portal circulation. In this case, what would happen to the plasma levels of ACTH, insulin-like growth factor, and oxytocin?
Okay, ACTH and insulin-like growth factor levels would decrease, whereas oxytocin levels would remain the same, because ACTH and insulin-like growth factor depend on releasing hormones from the hypothalamus. So without those being transported through the hypothalamic hypophyseal tract, you're not going to have stimulus for them to be produced. But whereas oxytocin is produced in the hypothalamus and by way of axonal flow goes to the posterior pituitary where it's going to be released from, so there's no involvement of the blood.
Correct. Okay, so we got to get the scores now, and then we'll determine whether we have a clear 1, 2, 3, or whether we need a tiebreaker. So we've got 2, 2, we got
1, 4, and 3.
I think,
Wow.
and then 3. So we do need a tiebreaker between Basatima and Aga Khan. So the top team, so automatically first place is Lyra. And Bara is a automatic second place. And Busatima and Aga Khan are in a tiebreaker.
Okay.
So now, so the tiebreaker is, so you each bring one member of your team forward at the same time. So Aga Khan and Busatima send one of your members forward. And so the format is going to be, I'm going to read a question, and if you know the answer right away and you say it, but I will also have the opportunity to read it a second time. Whoever answers first, and if they answer correctly, they get 1 point. If they answer incorrectly, they automatically get a -1, which means the opposite team has automatically become the third place winner. So only one question is going to be needed here, because either the first person answers the question and moves forward, or answers wrong and the other team comes forward. So only one question. Okay, I'm going to let you pick out of 21, 22, 23, and 25, since I have this other one. You choose. So it's going to be very independent. This one, okay. Okay. So the question is, and again, if you know the answer, and if I start reading it a second time, just yell the answer, and if you're right, you get your points. Your point. Why are antihistamine drugs effective in treatment of gastroesophageal reflux problems? Both. Okay. So it becomes a tie. At the same, which is, somebody. So we're going to have to give us, what we're saying is we're going to, what you're saying is.
Sudden death. Sudden death is better. Sudden death.
Which is sudden death. That's. Well, we only have 4 more questions, but. Okay, so I guess I don't know what you mean by sudden death. What? Okay, help me. So ask each team until, we now have 4 questions, so we've got 2 questions that I can pull some that we didn't use for the last round. Okay, so I'll go in the order then. Okay, so which team wants to go first? I'll let you choose. Which one of you wants to go with the next question? Okay. No, wait, what? We can't let them know the answer before the question. Oh, the question number, okay. But we didn't print them out on a piece of paper, and I don't know whether we really need to print it out on a piece of paper. Wait, I didn't have papers on these. Okay, so we're gonna make you pick. Okay, so we haven't done 21. We haven't done 23. We haven't done 24. And we haven't done 25. Now we're going to let them pick a number again. So each of them are going to pick one number. Right. And so which number did you pick? Okay, grab his number. Okay, question 24. Name 2 ways that smooth muscle myosin differs from skeletal muscle myosin?
Repeat the question.
Name 2 ways that smooth muscle myosin differs from skeletal muscle myosin.
Smooth muscle myosin has the light chains, whereas heavy skeletal muscle myosin has only the heavy chains. Number 2, the smooth muscle myosin
30 seconds. So, the 30 seconds went up. So, -1. But we have another contestant. And so, what's your question number? 21. Pardon?
-1 if you don't get the answer, 1 if you get the answer.
But if he doesn't answer, he gets a -1. Yeah, is that what you said? Yeah.
If he fails the answer, it is -1.
If he doesn't answer at all, it means he failed the answer.
That's
yes.
0.
Right.
That's 0.
So there's no zeros here. It's 1 or -1. Okay. Name 2 mechanisms by which the kidney helps compensate for respiratory acidosis. Where in the nephron does each mechanism take place? Name 2 mechanisms by which the kidney helps compensate for respiratory acidosis. Where in the nephron does each mechanism take place?
All right, ammoniogenesis, which takes place in the proximal convoluted tubule, and you said respiratory alkalosis. Acidosis, alkalosis?
Acidosis.
Acidosis. So there is reabsorption of bicarbonate in the proximal convoluted tubule, and then ammoniogenesis in the proximal convoluted tubule.
Okay, I didn't hear what the last part was. Repeat the last part.
Ammoniogenesis, reabsorption in the in the PCT, proximal convoluted tubule, and bicarbonate reabsorption in the proximal convoluted tubule.
I'm missing whether or not. 20. Did he say this? The first part for sure is fine, but not the second part. Incorrect, which means we go to another round. And if these don't work, I have some. We didn't do the extra questions in the first round, so I have some more questions. Okay, so what number?
25.
Okay. What are the sources of heat loss for a person immersed up to the neck in a 40-degree water bath? I'll repeat it. What are the sources of heat loss for a person immersed up to the neck in a 40-degree centigrade water bath?
We shall have heat loss by sweating. Since the head is not immersed, we shall have heat loss by air, expired air through expiration, and we shall have heat loss through the mucosal surfaces of the airway and the respiratory by evaporation.
Read and see, because I'm going to agree with. Yeah. Yeah. No, 20, 25. I actually think it was correct. I think it was correct. No, well, I don't know whether he might have used wording for that, though. I don't know. Should we have him repeat the answer? Correct. Correct.
23.
Some patients with cystic fibrosis have pancreatic duct obstruction. Why would these patients have steatorrhea, fatty stools? I'll repeat. Some patients with cystic fibrosis have pancreatic duct obstruction. Why would these patients have steatorrhea, fatty stools?
All right, that would be because the pancreas is involved in the formation of enzymes which would be absorbed in fat absorption. So that is lipase. So when the pancreatic duct is obstructed, then lipase is not getting to the food, so digested food, which means that there is malabsorption of fats, which results in fatty stools or steatorrhea.
Correct. Okay. So since you are both correct, I need to go and get some more questions. You have a... No, this doesn't have an objection. You didn't answer the full thing. You didn't talk about convection. This one we already asked. Oh, we don't. We only have one. Okay, so we only have one more question in our question bank, unless we go back to repeating a question. We did in the rules have a solution for if we're having difficulty breaking the tie. And either, should we just go back to the... Okay, I got them right here. You have the instructions, right? We had rules. We were only going to do 3 in this to begin with, and so we said that we have a plan, but we're differing on what the plan is. I want the written version that we have. But you had the copy. Here it is. The tiebreaker. We did 3. Okay, so then one more, but we've only got one question, which means that we have to, unless we do a different team member, though. We were supposed to select a different team member, so a different team member come forward. Should we do it in, should we? Well, we've only got one question. The alternative, we've only got one question left, and that is. Maybe they should write this one. But if they both get it right, then they'd have to go to then we'd have to go to the. Yes. So I'm just thinking, so the only one we have left is, the only one. No, it says 3. It says 3. So we have one more question left, and that is why this is the question. So this is the question. So what we can do is, my bet is they're not going to jump forward real fast with that.
Since we can't ask one person first, when they're right,
What she's saying is they're right. They both right. Okay, so since we only have one question left in our bank of questions, what we're going to do is have you each write the answer to the question. If you're both right, then we will go with the fact we've gone through 3 rounds of tiebreaker. And the rule then is to use the team score from the multiple choice question as the determining factor. But at this point, then what we've got is you can each write the answer to this question. And if one of you gets it right, that's who goes forward. If you both get it right, we'll go to the using the multiple choice. So, yeah, you can go to your table and write. Yeah, go to your table and write. Oh, because then you'd be, okay, I'll go up to those tables. Those tables have nobody sitting. Yep. Okay. Get him a chair. Okay. We get up, magic markers are sitting right there on the, magic markers are, oh, they're given the magic markers. That doesn't make any difference, that's fine. Okay. All right, so I'm going to read the question. What would be the physiological consequence of damage to the pineal gland? What would be the physiological consequence of damage to the pineal gland? All right. Okay, all right. Incorrect. I can't read this. It's missing. Yeah.
What the Y is missing? This one is okay.
Wait, where is this? Where is this?
So
But it's missing. It's missing. It's partially correct. It's missing. Yeah, it's missing an important component. So you have. So we are going to now just go by the rules and use the score from the from the multiple choice questions. Just proves that you were all good because it had to keep going and going and going. So. All right, so we'll go back to the scores. I don't have them in front of me from the multiple choice questions. I got it up here on the screen. I've got it, I can see it. Have you got it easy? So I think it's Bustima, right? I think it's, yeah, because I think. You guys. Yeah. But it doesn't say, it doesn't say. Okay, they're trying to decide, let me see. I'll let you, but no, this one, and melatonin was really important. This one misses the circadian cycle. And actually, this will be the team that's going to win anyway, so.
But we have a concern. No, we have a concern. Before we leave this, before we go to the notes, correct. But from the first time, the first time, Agatha won at the first time. So Agatha won for the first time, and we had to do this. So if there's any way, I don't know how, like that's.
I'm missing what you're asking.
No, at first, like the first question that was, everyone has to say.
But then we ended up not counting that one. Yeah. Yeah. Right. And what I'm going to say about this is, and that's the team that wins anyway. So we don't need to worry about. Yeah, for sure. So.
They were number 9 and number 8.
They were teams 8 and 9 going from the semifinal round. Busatima was 8 and Aga Khan was 9. And the question about whether or not, the reason we're saying you didn't talk about the circadian rhythm on this. But you won. So Busatima. Pardon?
Let's wait. The other issue is, let's just be fair. With this one, now talking to me, this one means the circadian rhythm. This one means the melatonin. So still, we have to recheck.
I said both were wrong. I declared both wrong. Busatima won because of the thing. I just said if there's an argument about this, then it's not, the big thing was melatonin. And then, But nonetheless, that's what I said. It doesn't make any difference about that round.